Hello, my name is Emma Weekly, and I will be doing the abdomen reply post today. First, I would like to get started on the subjective assessment, but before I get started on that, I would like to say the reference that I'm using for a majority of this video is this book that we have been using, the Physical Examination and Health Assessment by Jarvis and Eckhart, 9th edition, and I use this reference to follow along all the way through this video. So starting with the subjective assessment, you're going to ask your patient pretty much interview questions to get a better understanding of what their symptoms are and what's going on. So start by asking about have they had any appetite changes, any weight changes, and if they have, how much did they gain or lose? Then go on to ask about swallowing problems. Is their swallowing okay? Is it normal? Are they having difficulties with swallowing, and is there any pain associated with it? You can then go on to talk about food intolerances. If they do have food intolerances and have noticed this, ask about the symptoms they are experiencing, like heartburn, indigestion, bloating, belching, and so on. You could go a load of variety of things there. After you ask about food intolerances, ask about abdominal pain. Do they have pain in their abdomen? And if they do, ask them to pinpoint the exact location and then go into a in-depth pain assessment. Ask about alleviating factors, aggravating factors, the quality, the severity, when did this all start, and so on. Ask about past family history and their past history of any abdominal diseases like gastric ulcers, gallbladder disease, liver problems. Have they had jaundice or anything like that, and so on and so forth. Then you can go on to ask about what meds are they taking currently? Do they drink alcohol? And if they do, how many drinks per day do they drink? And are they a smoker? And if so, how many packs per day do they smoke? Last thing you will then, no, there's two more things. You want to also, oh no, there's a couple more things. You want to ask about, do they get nausea and vomiting? And if they are vomiting, ask about the characteristics. Ask about the color. Is it bloody? Is it normal appearance, like how it should be? Does it have odor? And what are the characteristics, like the appearance? Is it coffee ground-like? Does it have lumps? Does it have, like, what is the overall appearance? And just characteristics and all. Then go on to ask about bowel movements. When was their last bowel movement? What is the normal consistency and color with it, and have they had any changes in that? One question that you particularly want to ask in older people is the use of laxatives. So normally older people like to abuse that without really knowing, so it is an important question to ask if they do, and how many times do they use those laxatives. The last thing to ask is nutritional assessment, and what you're going to do is ask for a 24-hour diet recall. And how that is done is just you're going to talk to the patient and ask them about what they ate the day before, like yesterday, starting the first thing they ate to the last thing they ate, and have them try to remember every single thing that they ate that day. And that is really it for the subjective assessment. We will now get into the objective abdominal assessment, and I would just like to start off by saying for this assessment, the patient needs to lie down flat to properly assess. So, let me just get a little better angle here. We are first going to start off with inspection. So, you're just going to first look at everything. Look at the color and consistency throughout the abdomen. Is the color the same throughout? Is there lesions or masses on there? Another thing you can look for is a pulsation. So sometimes that can indicate hernia, but usually a pulsation in the middle epigastric area, that is your aorta pumping blood through the rest of the body, and that is normal. You can even feel for it too, but that won't be until we get to the palpation. So you're just gonna look for that pulsation movement. Look at the general appearance of the abdomen. Is it symmetric as they breathe in? Is everything looking the same as it should be throughout? Look for asymmetry, and if there is asymmetry that you notice, that is abnormal. And then the last thing you want to inspect for is the patient's overall demeanor. They should be relaxed, sitting comfortably, respiration should be slow and even, and if not, like obviously if they seem to be discomforted or in pain, then you need to go on and do a further assessment. After you inspect the abdomen, you're going to auscultate. So usually you inspect, percuss, palpate, auscultate. This time it's inspect, auscultate, percuss, palpate. This is because if you percuss and palpate before, it can increase paralysis of the organs inside, like your small intestines and your stomach, and just give false interpretations of bowel sounds. So that's why you auscultate next. And we are going to do that, taking our stethoscope and lightly placing it on the right lower quadrant, which is where we are going to start with. The right lower quadrant to the right upper, to the left upper, to the left lower in a clockwise way. And that's the same pattern we are going to do for percussion and palpation. You're going to listen for 1 minute. In this case, I'm not because of time, but listen for 1 minute. And it should be under the patient's clothing. So right off the bat, I can already hear gurgling sounds and cascading sounds. That's what you want to listen to. High-pitched gurgling or cascading sounds for 5 to 30 occurring. If it is lower than 5, that is hypoactive bowel sounds, and if they are higher than 30, those are considered hyperactive, and those are abnormal. It should be between 5 and 30. So that's really all for auscultating. Now we're going to percuss, which is just that light flick, and I got this from a resource, Percussion, titled Percussion. It's a website, has no date, and you're supposed to be listening for a tympanic and dullness due to the air-filled chamber. So obviously it's going to sound different from here than the chest assessment we did previously. So you're just going to go in that same clockwise pattern, starting with the right lower quadrant. And yeah, I mean, it does sound dull. Definitely a different noise than the chest. And that is what you are going to do. That's really all. After you percuss, you are going to palpate. Start lightly palpating to feel for tenderness or just get the overall feel of everything. You want to ask your patient if they are feeling any like pain or tenderness in that area while you are palpating. I feel nothing. So after light palpation, go into deep palpation, which is 2 to 3 inches deep. And you really want to feel for any masses, any bumps that you feel. You can also feel like for the organs and what their border is like. You feeling any tenderness? Yeah. Does it hurt? Or is it just from
uncomfortable?
Okay.
Yeah, from
Okay.
touching.
All right. And you're just going to do that. So on deep palpation, you can also feel for organs. However, it is more precise doing it through imaging and x-rays. So really, I don't think it's the greatest way to feel for the organs, but the liver is on the right upper quadrant. You would feel for a firm border until you don't feel that border. The spleen comes across the upper right the upper quadrants. However, you can't palpate that unless it's enlarged 3 times the size. The kidneys are located on the flanks. You would take both hands and you would feel for one kidney at a time. And then lastly, you have the aorta, which you would feel. You would go midline and a little to the left to feel that aorta pulsating, which I feel, and that is normal. Lastly, I would like to talk about one abnormal finding, and that would be the spleen enlarging. So if you suspect the spleen is enlarged, it can carry down to the lower quadrant. So you are going to start palpating from the lower quadrants up. And once you feel the enlarged spleen, stop palpating because it can rupture easily from how inflamed it is. The spleen can come from complications such as HIV, portal hypertension, hepatitis, jaundice, things like that. And that is really all I have for you today. Thank you for listening.